Well, we have all heard of a high blood pressure before, and we all know it could potentially be dangerous. But do you know why it is dangerous, what symptoms it can cause, and how to prevent it? Well, we will be answering all these questions and many more in this video. Therefore, make sure to watch the whole video so you don't miss any important information. And for those of you meeting for the first time, my name is Raoul. I'm a medical doctor from the Netherlands, and it's my mission to medically educate you, my viewer, because educated people make healthier decisions. And remember, I'm just a random doctor from the internet. I know nothing about your personal situation, therefore I can't provide you with personal medical advice. Always contact your doctor for personal advice. Let's get learning. So before we dive into high blood pressure and all the consequences, it's important we quickly recap your cardiovascular system and cardiovascular diseases. This will make it easier for you to grasp the concept of high blood pressure and the damage and consequences it can cause. So in essence, it's quite simple. Your heart is a muscle which pumps blood through your body with every contraction. Your blood flows from the heart through the arteries to your organs and muscles, and then back to the heart through the veins. This functioning of your heart is basically a cycle consisting out of two steps. The first one is the contraction, where your heart muscle contracts. This is in medical terms called the systole. The second part of the cycle is when your heart relaxes. So after it contracts, it relaxes and it fills up with blood again. This in medical terms is called the diastole. So as you might imagine, both have a huge impact on the blood pressure. And those of you that ever had their blood pressure measured know this, because you always receive two numbers. One standing for the blood pressure during the systolic phase and one for your blood pressure during the diastolic phase. Both are given as millimeters of mercury. In addition, it's important to know that our blood vessels are damaged over the years. This can lead to the buildup of plaques of fat, cholesterol and other substances in your arteries. In medical terms, this is called atherosclerosis. If these plaques become big enough, they can block the flow of your blood through these arteries. Furthermore, they could also rupture, creating blood clots. Both can lead to decreased blood flow to the end organs, causing potential damage and ultimately leading to several complications of cardiovascular disease. This process of atherosclerosis can be sped up and increased by several risk factors. And I guess you know most of them already. Being overweight or obese, having diabetes, having a lack of physical exercise, having a high cholesterol, smoking, and yes, a high blood pressure. And you might wonder now, what is a high blood pressure and when is your blood pressure too high? Well, a normal blood pressure would be a systolic pressure of 90 to 120 and a diastolic pressure of 60 to 80 millimeters of mercury. At a systolic pressure of 130 to 139 millimeters of mercury and a diastolic pressure between 80 and 89 millimeters of mercury, there would be a stage 1 hypertension, which is the medical word for high blood pressure. From at least a systolic pressure of 140 and a diastolic pressure of at least 90 millimeters of mercury, there would be a stage 2 hypertension. And in some people, a high blood pressure can lead to several symptoms, and the higher the blood pressure becomes, the more likely someone is to develop serious symptoms. It may lead to severe headaches, nosebleeds, fatigue, confusion, vision problems, chest pain, difficulties breathing, irregular heartbeat, blood in your urine, pounding in your chest, neck or ears, dizziness, nervousness, sweating, facial flushing and blood spots in your eyes. Which brings us to maybe the most important question of the entire video. Can you click the like and subscribe button? No, all jokes aside, these videos cost me a lot of time and effort to make, and I hope you're learning a lot. If you do enjoy them, please click the like and subscribe button. This helps out the channel tremendously, and in return you will never miss such an awesome medical video again. It's free, you can always change your mind. Now, let's continue with an actual important question. When should you contact your personal doctor? Do you experience any of the previously mentioned symptoms? Or do you have any of the mentioned risk factors like being overweight, high cholesterol, do you smoke, do you drink alcohol regularly, or do you have a sedentary lifestyle? Then it might be wise to contact your doctor. And when visiting your doctor can help you to find out the extent of your symptoms and find the underlying cause. Your doctor will do this by asking about your current symptoms, your medical history, the medication you're using, and afterwards your doctor might do a physical examination, blood pressure measurements, an ECG, which is a recording of your heart's electrical activity, some blood tests, and if necessary, a coronary angiography, which is a procedure that uses X-ray imaging to see your heart's blood vessels. Furthermore, your doctor could refer you to a cardiologist or a dietist, depending on the underlying cause. Which brings us to the most practical part of this video. How can you lower your cardiovascular risks? It all starts with one word: lifestyle. So stop smoking if you are smoking, limit your alcohol consumption, exercise at least 150 minutes each week, consume a balanced diet with low levels of saturated fat, salt and sugar, eat plenty of fibers, fruit and vegetables, maintain a healthy weight, have a structured sleeping schedule while sleeping 7 to 9 hours each night, and decrease the stress you experience. You could do so by maintaining social contacts, doing fun activities and relaxing. Here it could also be helpful to measure your own blood pressure at home once in a while. These results could be useful for your personal doctor. As we already knew, lifestyle interventions can have a huge impact on your cardiovascular system and your blood pressure, but they are not easy, and sometimes they're frankly not enough. In these situations, your doctor might recommend also some medical treatments, starting off with several drugs which could help. Your doctor might prescribe diuretics, also called water pills. These can help your kidneys to eliminate sodium and water from your body, lowering your blood pressure. An example could be hydrochlorothiazide. Your doctor could also prescribe ACE inhibitors. These can help to relax your blood vessels, lowering your blood pressure. Next up, your doctor could also prescribe angiotensin II receptor blockers, like losartan, or calcium channel blockers, like amlodipine, which both also relax your blood vessels. Your doctor could also prescribe alpha blockers, which reduce the nerve signals to your blood vessels, lowering the effect of natural chemicals that normally would narrow your blood vessels. Lastly, your doctor could prescribe beta blockers. These reduce the workload of your heart and widen your blood vessels, causing your heart to beat slower with less force. Beta blockers include atenolol. Here it is important to mention that your doctor will usually recommend one or more of these drugs to lower your blood pressure and decrease your cardiovascular risk. Now, I hope you know now what blood pressure is and what consequences it can have. But if you have more questions, let me know in the comment section and I will do my best to answer each and every one of them. For those of you that want to keep on learning, I also made a playlist about cardiovascular risk. You can find it in the description or by clicking the link up there. All I want to do now is thank you for watching. I hope you found this video helpful, and if you did, please consider liking and subscribing to the channel. I will be posting weekly medical videos, and if you subscribe, you will never miss such an awesome medical video again, and you will help out the channel tremendously. For those of you that can't get enough, I also posting weekly on Instagram at How to Medicate. You can find me there, and I want to give a special thanks to my Patreon supporters. Thank you, Sebastian, who is an investor tier supporter. And I want to thank you all, and I'll see you next week with a new video. Bye bye.